Okay, this is Dr. Edward Conrad, and it is noon, and I'd like to welcome everyone. This is the second weekend of our vision event, and it's really a great pleasure for me to have my good friend, Dr. James Mcnair, join us. Many of you think that I'm the only ophthalmologist that embraces these alternative therapies, but you're wrong. Dr. Mcnair embraces all of these therapy. He wears two hats just like me. He's a board certified ophthalmologist, does a lot of surgery, but he really believes that there are better ways to heal the body than surgery. He's going to be giving his presentation at the end. It'll be open for questions for him directly. There are two ways that you can ask a question. One is you can type it into the chat. The second way, there's an icon down below. It's called reactions. You can type, raise your hand, and then we'll see that you want to ask a question, and then we'll unmute you, and we'll take care of that. So, Dr. Mcnair, it's really great to have you, and I'm really excited about your new book, Smart Way to Healing. So the floor is yours. Great to have you.
Well, thank you. Can you hear me okay?
Yep, you're coming through fine.
Okay, good. Well, first, thank you very much, Dr. Conrad, for asking me to do this. And I've had a strong interest in integrative medicine for a long time.
Hey, you wrote a book.
Oh, we've got somebody not muted there.
Yeah, make sure that everybody's muted. We can't have all this background noise, all right? Go down to the lower left on your screen and make sure you're muted. We hear a lot of talking in the background, and somebody's in the kitchen cooking, doing dishes. All right, I think we got everybody muted.
Anyway, so I've had this interest in integrative medicine for a long time, and I have two small things, but they're also very important issues that I wanted to present today. But I also, I'd like to open up my book and show people many of the things that are involved in integrative medicine. You've been a big part of this, Dr. Conrad, because 20 years ago, I guess, when we first talked, I learned a lot about what you are doing for people and many of the innovative things that you come up with. And we're going to be touching on those things today some. And so your approach to helping people with their vision certainly encouraged me to look outside of the box, so to speak, as far as helping people with ways of treatment that just are not standard ophthalmic, but they're very well-known issues.
Vision 2022.
Uh-oh, still someone not muted yeah. There. So anyway, my experience has been as a medical doctor trained in ophthalmology, went into Capital University of Integrative Medicine and worked there and got a degree in Doctor of Integrative Medicine. So I've had some extra training there, and that I would like to share some for two very important issues. Like I said, I wanted to focus on two things first. Let me see if I can dial down here the, okay. Hey, Jen. I'm not, my slides aren't moving, Ed.
Get your tech guy.
I know, that's why I got to get my tech guy. Okay, hold on. I'll get my tech man. Hey, Jenny, would you ask Wesley to come in? I'm having with my slides now. Ed, I've got to get a little bit higher tech than what I am now. I'm a low tech guy, you know. I'll get my son to come in and help me get these slides going here. But anyway, I wrote this book to help people understand there are many well-documented ways of helping a person heal. Wesley, I'm sorry, I can't get this moving now. I tried.
Just click, got it. And then you're good to go.
Oh, okay,
Said the click.
okay. All right, good deal. Thank you. Okay, so anyway. So the two main issues I want to talk about is the dry eye syndrome problem. I would not be surprised if there's not someone in our audience that is having that problem. It is such a common, in fact, it's the most common complaint that comes into our office. And so this is a good description right here of how people feel about their dry eyes. Another nice picture that shows this. And so if a person has had this kind of problem, they know their eyes can be dry and itchy and scratchy, or they can be tearing. They can be tearing and be a problem that way. But so a wide range of symptoms that people can have. Usually the eyes are dry and red appearing. A lot of people are always rubbing their eyes because it makes them feel better when they do that. A lot of tearing can be the problem. And in fact, I'll tell people they have dry eye problems. They say, oh no, doctor, can't be dry eyes because I'm tearing all the time. So try to explain to them, it's the tear film that is not lubricating your eye, and that is the problem. And so we need to deal with the tear film. So there's many good treatments. And by the way, integrative medicine means we don't divorce ourselves from the good ophthalmic treatments that we have. There's a lot of wonderful things for all kinds of diseases out there that ophthalmology has. So we're not saying forget all that. All we're saying is that there's other things to add to that with the integrative approach. So one of the main things is drops. And we've got, this is just one brand that we recommend a lot, but there's a number of good brands of preservative-free. I like to use preservative-free drops more than the standard drops, because many of the preservatives can actually be irritating to the eyes if you have to use it a lot. So there's a number of drops out nowadays that are preservative-free. I don't have any attached to any one drop, but this one we use a lot, but there's a lot of good drops out there. And so I just encourage people though to get the preservative-free drop, and that will help a great deal because you can use it every hour if you need to for symptomatic relief. This is a picture of steroids. It's what right in the middle there with Arnold, but there's a number of good other drops like Restasis, Xydra. We can use antibiotic drops sometimes. Sequa is a relatively new drop that are, again, symptomatic relief. They work in an anti-inflammatory way. They also have a stimulation of the glands that help produce mucus and meibomian gland fluid oil. And so there's a lot of good ways with the drops that we have available here. Many of you may have tried these before. And again, I endorse these. We use a lot of Xydra, I guess, more than anything else because of insurance covering it. Restasis we use because of that same reason. Sequa is relatively new, but it has a value there. And then the steroids, by the way, there's a number of good steroid drops. Flarex is one that we've used recently. That again will help symptomatic relief, give people a chance to be able to function better in this kind of thing, which is always a concern. Other treatments, we have a number of other treatments. For instance, this picture illustrates the ducts that are in the nasal part of our eyes that are basically invisible unless you're looking for them. Those little ducts that you can actually plug, that the picture shows a plug in the lower lid of the canaliculus is the term for that. The canaliculus leads to a little duct that goes down to the lacrimal sac and eventually down into the nose. So that's how you notice sometimes you can put drops in your eyes and actually taste the drop as it comes down in the nose. And so that's the canal. If you block that, then you will have a better tear film, theoretically, to lubricate your eye. So if you're not making enough tears is one thing, and the other is to try to preserve the tears that you are making. And now here's a treatment. I've actually never seen this in person. This is treating the term meibomian gland refers to, if you can see in this picture, a bunch of little glands are illustrated in the upper and lower lids. There's about 40 meibomian glands. They make oil, and the oil is one of the main lubrications of the tear film. So the meibomian glands can be warmed just with simple warmth, by the way, just taking a towel and warm water and this sort of thing and applying that to the eyelids will help loosen the meibomian gland oil and therefore help the lubrication. So these can be opened. They can be physically opened. Sometimes I've actually taken forceps and physically opened the meibomian glands to encourage the oil gland function. You'll see more in just a minute what I'm talking about here. But so this is one way of improving things. Now, by the way, this treatment here is just basically addition of warmth on the meibomian glands. That's something you can do in a doctor's office. And here's, by the way, these are meibomian glands that these little whitish yellow pouting meibomian glands are inflamed, and they need to be opened and treated with antibiotics. And that can be done a number of ways, either by mouth antibiotics or topical ointments and drops to treat the infection. So that's a nice way to help things. This is a laser treatment to help. Now, this is Equinox low-level light therapy. To treat the eyelids, you can actually take those shields off that are on that patient and protect the eyes. You have to put little shields in the eye, and then you can apply low-level light therapy that will actually stimulate the healing of the meibomian glands to help function better. So that's a nice way to do that. I don't have that instrument myself, and I have never needed that instrument, but I think that's certainly not, it's potentially valuable, I should say. So when I talk to people, I always start with the treatment first, encouraging people to use the drops, use Xiidra or another therapy like is a prescription therapy. And I encourage that, but I also tell them that there's a way to cure the problem if you will do these things. These are fairly simple. Number one thing is water. And of all the things I've encouraged people, this is one of the main points I want to get across to people, is that you must drink enough water, not just for the eyes, but you need to drink enough water for your whole body. And this is so important. And we're not talking about coffee, tea, cola. We're talking about pure filtered or bottled water. And you might also look into alkaline water. Alkaline water, theoretically, what that means is our body is so acidic based on what we eat and drink that the acid environment is not profitable for the body. In other words, too much acidic blood is circulating around in our bodies, and it's not functioning normally. So a lot of diseases can be helped just by drinking alkaline water or eating fruits and vegetables, which help alkalinize the body. And so that's something I emphasize to everyone, to eat more fruits and vegetables and drink water. So how much water? Well, it depends on the size of the individual. It's amazing what health people recommend. Half of your body weight in ounces, like a 150-pound person like myself should drink theoretically about 75 ounces of water a day. So, which is a lot more than, frankly, than I drink, but I drink probably 8 glasses of water anyway. But I eat a lot of fruits and vegetables, so I get a lot more water that way too. And so anyway, that is a key for dry eye problems. If a person will drink enough water, it almost always will stop the problem. Not only that, but I've seen 2 people in my life who've had a stroke who were well hydrated. Water helps prevent strokes, not only to the eyes, but also to the rest of the body. Kidney stones, you'll never find a kidney doctor that doesn't recommend water because it helps prevent kidney stones and other issues of the whole body. So water for people, very, very important. This is the little demonstration of acid and alkaline. In other words, our body should be in the more neutral range. You get more alkaline by the fruits and vegetables. You get more acid by drinking colas and other dairy causes more acidic. Too much meat can, and other foods can, that like grains and this kind of thing will lead to acidic environments. So again, more vegetables and fruits will help the alkaline part of the body. So these are the red meats, pastries, milk, grains, like I said, hard liquor can cause too much, ice cream, et cetera, et cetera. So there's a very important balance of the body that needs to be attained. Cigarettes, coffee, those kinds of things will cause acidic formation in the body. So again, you don't have to stop necessarily these other things that you enjoy, but if you emphasize this kind of food in your body, you're going to have a better tear film for the dry eyes, but also for your whole body, you're going to have a much healthier system. And a healthy system leads to healthy eyes, by the way. For dry eyes, the supplements, this is one of the more important things too. As I mentioned a moment ago, in fact, let me go down here. There's a tear film that actually is made up. So here's our cornea near the eye here, as you can see the word cornea. The very next word is mucin layer, which means mucus, just like we have on the inside of our mouth, and that lines our bronchial tree, esophageal tree, our GI tract, I should say. It is very important to have mucus on the tear film. And I'll tell you in a moment a little bit more about that. And then water, that's the aqueous layer, and then lipid, the oil layer. Just like if you pour oil in water, the oil comes to the top. And so that's on the outside of the tear film. We didn't know all this until not too long ago, maybe a score of years ago, but that has, to my knowledge, has never been emphasized that much. But this is what I like to encourage people to do. Get fish oil or krill. Krill is another source. Flaxseed may be okay. But what I'm saying is get omega-3 oil, like the bottle says, they're omega-3 fish oil, at least 1,000 milligrams a day. Now, there are contraindications. I understand some doctors don't want the fish oil for various reasons, blood thinning and that sort of thing. So you always check with your family physician, but if there's no contraindication, this omega-3 oil is very good for the whole body. And again, for the eyes, can really make a difference. Then NAC. Most people have never heard of this supplement, but it's a very important, in fact, I think becoming more popular now. It's N-acetylcysteine is what that means. And did I not, I should have, yeah, here we are, N-acetylcysteine. So what is that? Well, for the eyes, what it is the precursor. That is an amino acid that theoretically we should make plenty of it in our body. As the body needs it, it should be made, but oftentimes it's not. And so we take a supplement of N-acetylcysteine, and it will help make more mucus. Not only that, by the way, I don't think I have the word down, but glutathione. Glutathione is a very important molecule in our system. Every cell of the body has glutathione to detoxify. Detoxifying the whole body, again, will help the tear film, but also helps every system work better as it is detoxified. So this is a great supplement. We usually use 600 milligrams, but it comes in more if you need to. And this is a game changer for a lot of people. To take that supplement can really make a difference. And it's inexpensive, by the way. You can get that online, Swanson's and Pilgrim's Pride, and there's a number of good online or you can get at the health food store, usually not pharmaceutical companies, usually not, but usually takes a health food store, like I say, or online. But so we have the aqueous layer again, that's the water, the lipid layer, the mucin layer. And if you supplement those to have a healthier tear film, almost always the symptoms go away, almost always. And if not, then some of the other treatments again are going to help to get a person more comfortable and at least where you can function well and this sort of thing. So now there's more to it, but I want to talk about those main things, because if we do these things, both the treatment and the preventive or the curative ways of dealing with this, almost always you can get rid of your problem. There is one overlap. I don't have a film of this, but there's one overlap of this, and that is allergies. And like right now in Florida, we have, this is allergy season, and we see a lot of people with allergy problems. Environmental allergies, I can't do much about, but I want to tell you about allergies real quickly, about food allergies. You need to read, get online and read about food allergies and document. What I'm saying about food allergies is dairy and wheat. Those two, there can be a lot of other things, by the way. I mean, you can be allergic to broccoli, but I'm just saying dairy and wheat are two very, very common proteins. The proteins of those foods can be an allergy problem. And for the eyes, I mean, it can be tremendous. And if you're willing to give up dairy, I'm talking about anything that comes from a cow, from milk, from a cow, or if and the other is wheat. I'm not talking about just whole wheat. I'm talking about the gluten protein of wheat. If you get rid of those things in your diet, things clear up allergy-wise. I personally have given those up. I knew for 35 years I knew to give those up. Didn't do it. Always had some sinus problems and all, but finally was able to give that up personally, and I can breathe at night, don't have trouble with colds and things like that. I just rarely ever get sick, because it's just a very nourishing thing to get off of those foods. Like I say, there are other foods too, so read about it. There may be something special for you that you need to get off of, but that can help your eyes tremendously. Now, the other thing I wanted to talk about, this is a real important issue, and I see very few doctors who know what I'm talking about when I mention this. And this term muscle dysfunction is something we just came up with.
Muscle
but that
dysfunction.
basically is what I'm talking about.
Muscle dysfunction.
I'm sorry.
Can we
There
have
was a question.
somebody please unmute? We want to eliminate the background noise during Dr. McNair's presentation.
Yeah, and I
so
would encourage everybody to write down the question, if you would, write down your question so you won't forget to ask. But and I'd be happy to answer any questions, by the way. And I'll do the best I can. If I can't, certainly Dr. Conrad can. But anyway, statin drugs cause a problem with muscle dysfunction. And I have seen many people over the years. I started 40 years ago. I started measuring everybody that came in my office. I started measuring their muscle balance. Now, I was doing it mainly because I had the time. I had the time to do it. So I just thought, okay, this is another way to do just a little bit of extra for this person. And sure enough, right about that time, statin drugs came on the market, treating cholesterol. And hallelujah, lowering cholesterol was a good thing. Helps prevent cardiac problems and this kind of thing, circulation problems and this kind of thing. It's not a big help, but it does help some to reduce cholesterol problems. And no question it'll lower the cholesterol. But and this was in the physician's desk reference. What I started seeing was people on the statin drugs, yes, their cholesterol went down, but they also started having focusing problems. Their eyes weren't working together well. And so, and I mean, it went in conjunction with their starting the statin drugs. So I said, well, there's got to be a reason for that. So I looked up in the physician's desk reference, and sure enough, there was evidence that not only did the cholesterol go down, but also the CoQ10 level goes down. Now, what am I talking about here? First off, here's all the statin drugs. I call them the demon statins. You can see little horns at the top there because the demon statins, because people don't know that they need to take CoQ10, it wipes them out. And I'll show you more in just a moment here. But anyway, the demon statins can cause this. This is kind of being silly here, but this is the kind of thing we're worried about. But now this is the extreme. We don't see that. We see people who are complaining, however, of not focusing well, sometimes to a point of double vision. I've had over the last 4 years, I've had one person a year that has gone to the hospital because of double vision. They've had x-rays, 2 or 3 days in the hospital. Finally, I'll get called and said, hey, people are having trouble with their eyes. Can you come see them? And so I'll find out, sure enough, they're on statin drugs. They stop the statin drugs, start the CoQ10, and they'll be cured. Numerous times I've seen that over the last 4 years, particularly. So eye strain symptoms. It can be light sensitivity, itching, burning, dryness. Blurred or double is one of the main things I'm seeing. Squinting sometimes, and in fact, sometimes the eyelids are drooping, or we call it ptosis, P-T-O-S-I-S. Ptosis results from the statin drugs. And so we encourage people to take CoQ10. Now, again, I don't have any ties to any CoQ10 company, so we just have to have this one, a picture on the internet. So CoQ10 is responsible for energy in our muscles. In other words, if you are low on CoQ10, you will have a difficulty focusing, oftentimes drooping eyelids, and fatigue. Almost everybody, in fact, I've had 1 or 2 people maybe. When I say, Miss Smith, if you're not taking CoQ10 and you're taking statin drugs, you may have this problem with your focusing. So I want you to take the CoQ10. And by the way, you may have fatigue problems. And they say, oh yeah, I'm tired all the time. I mean, that's people tell me all the time that they're tired, and their doctor tells them, you're just getting older, Miss Smith. Well, that may be true, but you don't have to feel bad. As we age, we don't have to feel bad. We can still have good energy and still be very functioning well and this kind of thing. So here's CoQ10. Now, there's 2 kinds of CoQ10 I want y'all to be aware of. One is ubiquinone. Ubiquinone is good. It works almost always. It's inexpensive compared to ubiquinol, is on the right here in the red. Ubiquinol is a little more expensive. Health enthusiasts that I read say it's probably better used by the body, better absorbed, better utilized by the body. So if you start with the ubiquinone on the left, CoQ10, or you might want to wind up, if you don't get success, using the ubiquinol, which again is going to be twice as expensive maybe, but still worth the price if you're having the kind of troubles that I'm talking about. So these are 2 things I've told a lot of doctors come through our office who are residents, emergency room residents and family practice residents. And I tell them about this, and they say, well, I've heard of CoQ10, maybe I've seen it on television or something, but it has not been emphasized to most of the young doctors and most of the older doctors too. They may have heard about it, but they do not understand the importance of it. So this is one of my pet peeves, I guess, that I would like to encourage people to get aware of. Again, read about this online. You can see what I'm talking about, and it can be a big, big help, not only to your vision, but to your whole system to feel better, have more energy, and all the important things of life, really. Here's one more thing. I know very little about PQQ, but it also works with the mitochondria to help the mitochondria. I'm sorry, I brought up the term mitochondria without telling you. Mitochondria is the small organelle in our cell that produces energy. So to produce energy, you have to have the CoQ10 and PQQ apparently to help promote the mitochondrial function. And again, I'm learning more about PQQ and probably will be recommending it as well as the CoQ10. So those two work in synergy to help the mitochondria work better. So now, once again, here's the inhibitor. The inhibitor is the statin drug. Down below, statin drug, the devil, creates an inhibition of HMG CoA reductase. That's an enzyme in our body that makes both cholesterol, the bad cholesterol, and it makes CoQ10. So if you inhibit cholesterol, you're going to inhibit CoQ10. And that's why, again, the supplementation of it is so important. And by the way, let me say that the good news is, if you take, I didn't tell you about the dose, 400 milligrams. Usually the daily dose is 100 milligrams, maybe 200. But what I have found through trial and error is 400 milligrams will work for almost everybody. And I'm talking about the ubiquinone, the lesser expensive. The ubiquinone will work for almost everybody at 400 milligram level, not just 100 or 200. And by the way, you don't have to stop the statin drugs. Yes, that speeds it up maybe, but you don't have to do that. A lot of doctors don't want to ever stop the statin drugs because of the benefit of cholesterol. But sometimes now for the double vision people, I would say stopping the statin drugs would be smart, but I always ask their family doctor if it's okay, and so that we can pursue it in a way. Yeah, good. Okay, my wife just reminded me of something, but so integrative medicine, these are terms that are commonly used. Integrative medicine, functional medicine is another term. I love that idea. In other words, functional medicine means that if you put the right ingredients in the body, like water, oil, NAC, you put those things in and your body functions better because that's the way it was designed to function. And so if you think, hey, I'm just going to help my body function better by eating healthier and exercise and water and all these things, great way to look at it. Holistic is also a term that's used commonly and applies a lot to not only the physical body, but also our emotions, our mental state. And in fact, you'll see more about that in a moment here. But holistic medicine is taking in the whole body more. And that's what we like to think of with integrative, functional, holistic medicine. We like to put all those things together, thinking, how can we help a person really heal, really get well, not just treat the symptoms, but really get well from their problems. So this is the book Ed mentioned. This is a novice approach to a book. Dr. Conrad has books that are expert, well written, well documented. I did the best I could as a novice, but I'm hoping to revise this in the future and do a better job of putting. One of the people, several people have mentioned that after they read the book, they would like to know how to apply some of the features that I brought up in this book. And Dr. Conrad asked me to show y'all some of the things that we've talked about in the book that can apply not only to your eyes, but to the rest of your system. So let me show you. For instance, this is more the physiologic biochemical. So if you would look through this list, there's alkaline water. Avastin is one of the, I put Avastin because it is an integrative book. In other words, Avastin is very much a therapeutic. This is injections of medicine in the eye for macular degeneration and sometimes diabetes. And as part of the integrative approach, oh my goodness, it's been a wonderful thing to help these serious diseases. Now we like to get people to do other things before it gets to that, but Avastin is part of the, like I say, an integrative approach. Breathing techniques, far infrared treatments, you may have heard of that. EWOT is exercise with oxygen therapy. Very important and very helpful for a lot of people. Chelation is removing bad metals out of the body, heavy metals, lead and arsenic and mercury, and these kinds of things. Chelation can be a wonderful help for a number of problems. Hydrogen, I've never had great results with hydrogen peroxide therapy. What we're talking about is giving small doses, extremely small, homeopathic doses of hydrogen peroxide that help stimulate the healing of the body. IV therapy has been very, very helpful. I've had good experience with this, with post the COVID virus problems, the extreme fatigue and this kind of thing that associated with the COVID virus. IV therapy with vitamin C and B vitamins has been helpful. Ozone therapy, a lot to that. It's amazing. In fact, what can be done, stem cells, pardon me, amino acids, telomeres are really interesting. At the end of the our DNA chain and everything, there's telomeres that you can actually take supplements to help the telomeres. And then Wilson's syndrome is also an interesting disease in hypothyroidism. So y'all may look at these things, and if you have a question, just kind of jot down your question there real quickly. Now, the thing that most of the time, most of us do not understand well, and certainly we didn't when I was in training in med school and all, about energy. Like, for instance, when I went to med school, acupuncture was considered really far out there. And it's a wonderful way, though, to help energy. Auricular acupuncture, I've seen some wonderful things from that. That's actually using the ear, to points on the ear that can help a person. I've seen migraine headaches cured by the proper auricular acupuncture. Bioenergy balance, biofeedback, biomat, all these. Now, FSMC is frequency specific microcurrent stimulation. Dr. Condrat's an expert at that, has helped a lot of people with FSMS to help a person again to heal various parts of the eyes. And it's, again, this is something can be applied to the whole body. So again, you can look through these things. Energy is affected in so many different ways. In a negative way, microwaves, for instance, is a deleterious energy. And you can read about that. Music energy can be helped. NAET is oh my goodness, I've got to read this this lady's name. Anyway, she's an Indian lady that has a great way of helping through energy. The Zyto kiosk is a way to read a person's energy that you just sit for 5 minutes with your fingertips applied to a machine that can read what's going on in your system. Amazing, amazing things. So anyway, Reiki is Reiki, the energy that is being shared here. This is a Reiki technique. My daughter is a Reiki treatment person. She has helped a lot of people with her Reiki. Just it means sharing energy basically from the healer to the person receiving it. So again, there's a lot to each of these things, and I wanted to just show you what's in the book, and these are just helpful things, hopefully, for you. This is more the psychotherapy. Now, under psychotherapy, I put something that will help a person's healing is attitude. Your ability to have the right attitude. Down here is forgiveness, gratitude, love, marriage. Actually can help a person live longer. Prayer is a huge thing for a lot of people. Retirement can be both a negative and a positive. Self-hypnosis, the picture here indicates a hypnotic technique. I have gone through self-hypnosis and has helped me in many, many ways. And you reap what you sow. Very, very important. It should be SOW, by the way. So anyway, that's different concepts of psychotherapy that you may not think of attitude being part of that, but it is a tremendous help to have the right attitude in life and that sort of thing. Supplements, all kinds of supplements, bioidentical hormones, colloidal silver, healing salves. I've seen a friend of mine in school when I was at the Integrative Medical School who had a melanoma on his back that was healed by a healing salve. That was basically an American Indian product that he got in New Mexico. But so anyway, tremendous help. Iodine is important, so important nowadays for ladies, particularly, to be taking iodine. So it's there's a book I mentioned in the book that can be a big help. Low dose naltrexone is a big help for a lot of people. I didn't put CoQ10 in here, but you know how I feel about CoQ10. There's a lot of ways to help the body heal through supplements. And then touch, anatomical treatments, rather. Biocranial is one that treats the head and neck particularly. Bloodletting, believe it or not, is actually used for some things. Chiropractic treatment, very important. Colonics can be helpful. Craniosacral therapy. So, you know, massage therapy. My daughter also is a massage therapist, by the way. So anyway, all those are very, very important and can be a big help, the anatomical part of the body. And mind, body, and soul. And we're talking about a holistic approach with essential oils that can actually integrate into the body. Ayurvedic medicine is largely holistic. Detoxification, very important. Homeopathy, this is one of Dr. Kondrat's expertise in that. Again, a lot of things that can be in the holistic, just that are, again, outside of the normal range of medicine, but very, very important. Oh, thank you. Okay. And I think that's all. There we go. So.
Well, Dr. Mcnair, great presentation, and thank you so much for sharing all that information. And
Yes,
and the
sir.
listeners who might be interested in your book, which I think is a great book, you're being very modest about your book. You put a lot of work and effort into it. Folks can get it on Amazon or at their bookstore. But before we open the line for questions, I just wanted to make a couple of comments. You know, I'm working now with the VA, and I'm seeing a lot of vets that are coming back from the Middle East with severe dry eyes. And it's a big, big problem. You know, they have these burn pits over in the Middle East where there's like literally the size of a football field where they're burning garbage, feces, plastics. And these young vets are coming back with severe dry eyes. It's a big problem. And one thing that I find very helpful is Ozonated Eye Drops. I don't know if you've used them, Dr. Mcnair. Ozonated Eye Drops. They can be a godsend, really helpful, eliminates the preservatives and some of the more toxic treatments like Restasis and some of the steroids. Ozonated Eye Drops.
Oh, no
you
kidding.
can go to YouTube and type in my name and ozone, and you'll come up with some YouTube videos I have on that. Also, I know you talked a lot about the fish oils, and I've changed my mind about fish oils. Our body needs the omega-3s and 6s, but they should be in plant-based form. Dr. Rowan and Professor Peskin wrote a book on the dangers of fish oils. There's a lot of toxins in fish oils. Fish oils become rancid at room temperature. And some studies show that actually taking fish oils accelerates cardiovascular disease, which was a shock to me when I read that article. So we need omega-3s, but they should be in the form of plant-based oils.
Yes, yes.
So we have a couple. Are you able to open up the chat? There's a couple people have asked some questions.
Yeah, now,
You just click the chat at the bottom. You may have to get your technical advice.
I don't want to hit the wrong button. Hey, Wes, did you help me, son?
Yeah.
And also, if anybody wants to raise their hand, at the bottom of your screen,
What you trying to do?
there's a icon called reactions. And if you hit that, you can raise your hand and we'll unmute you, and you can ask Dr. Mcnair a question.
Talking about the chat, how to get chats.
Right there. Chat.
Okay.
I'm just looking here and I don't see anybody raise their hand. If I don't see your hand, you can just unmute yourself and just chime right in. Right now, everybody's
Oh.
muted.
Here we go. Yeah.
Oh,
Ed,
Charlene?
I do have one on the chat room here.
Yeah, Charlene has her hand. Charlene has a question. Maybe we'll take her first.
Okay.
Okay. Good morning, everyone, or afternoon
yes.
to you all in Florida.
Oh,
Thank you
good.
both of you. I learned so much today from your talk, Dr. McNair, and I very much value and enjoy your Southern accent. And your phraseology, I love. I have a comment for you, and then I have a question. Okay. Just because a lot of people in the medical community don't know the other benefit of NAC. I'm a big proponent of it because it helps with traumatic brain injury and concussion. There was a research project done by the Army, I believe, about 10 years ago now, maybe not that long ago. And it just came out that NAC helps the brain and with inflammation and the brain. So therefore you can have different procedures done or treatments done after you have a concussion or a TBI. Just a heads up, and this is just it's like you start with 5 capsules a day and for 5 days, and then you go down to 3 and 4 and 2 and 1, and it's amazing. So anyway, my neurologist gave me that immediately after one of my concussions. My question for you, Dr. McNair, is that lovely slide that you had with the tier pieces in it, from the tear to the oil, and I may not be saying that correctly, but I can see the picture in my mind.
Mhm.
Does the tear piece then affect cataracts and how they form, and then getting them to go away?
No, ordinarily not cataracts.
Okay.
You know, the lens of the eye is not affected by the tear film.
Okay.
The cornea is, by the way, and I think this was not recognized until the last, like I say, maybe 10 to 20 years. But how important the tear film is for vision purposes. In other words, the tear film, the integrity of the tear film is so important. It can make a difference for the vision. But the lens of the eye is not in connection with the tear film at all. Now we know other things that will affect cataracts, like the food you eat, the exposure to all kinds of things. Cigarettes are very important, and all kinds of things that can affect the lens of the eye. So but no, the tear film would not affect the cataract.
So, but the tear film affects the cornea. Is that what you said?
Yes.
That also affects the vision itself.
Oh, yes, definitely. No question. In fact, people tell me all the time, they'll say, well, yeah, my vision gets blurred and I blink a bunch and it clears my vision. So that's the tear film. Usually it's just like a windshield wiper on your windshield, you know. So yeah, so that's a good way to think about it. And so that's important vision wise. But to help, you know, there've been a number of people around the world who have said, well, I use L-carnitine was one, and there's Dr. Conrad, you may be able to help me with this. L-carnitine is supposed to help prevent cataracts or treat cataracts, but in my experience, I haven't been successful with that. So that's one of those things that where cataract surgery, thankfully, is what you have to do for bad cataracts. Now, I would say this: we respect everything about ophthalmology, including cataract surgery. As wonderful as it is, it can present problems. So we don't do it casually. You know, it's very important not to take anything for granted and to prevent a person from having to have surgery. Oh, that's a wonderful way to go, you know, if you can prevent it. But it is difficult sometimes to do that. And to Dr. Conrad's point about the oil, by the way, real quickly, oil, I agree. The plant oil, and in fact, I've just read something about that too. that would probably be a better way to go. But there's also potential problems with flaxseed, for instance. Flaxseed oil is one of the things I recommend, but apparently flax can have other problems, like with testosterone problems, is what I've read recently. And so in other words, there's some downsides to even to that sometimes. So, but I think you're right, Dr. Conrad. The more we can get away from the fish oil is probably better. Krill may be a cleaner source, by the way. Krill, Krill, that's what whales eat, 1 million of them every day. But the krill is supposed to be a cleaner source than standard fish oil. So that's a real good point. In NAC, by the way, I just read recently about NAC being important for the whole body. When I've been the eyes, but again, just like you said, the brain from, people, other doctors are getting on board with this to say, hey, NAC is a real therapeutic supplement. And so, yeah, I think that's real smart, Charlene. That's good for you.
Thank you. It also helps with the lungs when you have a congestion. So I love it.
Yeah.
It saved me.
Okay, way to go.
Thank you.
Yes, ma'am, you bet. So, and you mentioned ozone, Dr. Conrad. Ozone, yes, I agree. Ozone in the artificial, and I haven't done a lot of that, but I think I should start doing more of that. But I've seen wonderful things with ozone intravenously, ozone in joints. Oh my goodness, I've meant to mention more about the prolozone. Prolozone is a wonderful way to inject in the joint. You inject Novocaine, B12, and then ozone into a joint, and it will help tremendously to reduce pain and just heal the joint. My wife just did Ginger's knees the other day, and my daughter Sarah treated her, and it's almost totally painless, and it's just a wonderful way to help. So ozone can help from head to toe. People, please look into ozone for like the COVID virus and all that. It can be a big help, and there's clinics around the country that are using that nowadays. So very, very helpful. Okay, anybody else have questions?
I think you have a bunch of questions
Yes, here
in
we
the
are.
chat. Yeah.
As NAC is a precursor for glutathione, what is your opinion of liposomal glutathione? Would it obviate the need for NAC? And that comes from Maddie. And Maddie, at least I got your first name, I hope. So I am not familiar with liposomal glutathione. How about you, Dr. Conrad?
It's a way to, glutathione is broken up in the intestinal tract, so you really can't take it orally. And NAC is considered to be a precursor of glutathione. So the liposomal encapsulates the glutathione. So it's almost a way to get it better absorbed. So I agree, liposomal can be beneficial. Of course, the best way to get glutathione is intravenously. And a lot of doctors are doing that.
Yes.
As a very, very powerful treatment. But I'm a big advocate of the glutathione precursors. Garlic, onions, eat a lot of garlic, you'll increase your glutathione levels and also reduce stress because you have such bad breath, no one will be around you.
Good.
But they do have, they have the odorless garlic capsules now, which are pretty remarkable. So onions and garlic are good to increase those glutathione and NAC levels in the body. But yeah, the liposomal is good, but it's kind of pricey and expensive.
So it is, but it is very absorbed when you take liposomal.
Yeah.
Glutathione, theoretically, it'd be well absorbed. Olivia says, I know, I missed it. Here's Eli. What is the most effective frequency for laser treatment of glands? Laser treatment of glands. I guess we're talking about the meibomian glands. And I personally have not done what I showed you on the treatments that are available. I would suggest that, whatever doctor says to do, I would think weekly or maybe every other week would be effective. But you can do a lot at home, warm compresses, gentle pressure to help the meibomian glands function better. Also, omega-3 oil. Again, krill may be a better source than fish, or plant-based omega-3 oils may be better too. But to help the oil function, the meibomian glands function better. What I'm
Yeah,
saying there,
don't
that should
underestimate
help.
hot compresses. Very,
Yeah,
very
warm
good therapy. Yeah.
Very inexpensive, and you can do it every day, and it's very inexpensive and helpful. Now,
I was asking, I think last week we had a discussion about the waves, the wavelength is what I meant for the frequency, for the laser frequency, not like how often you should do it. A wavelength, yeah.
I thank you. I missed that, and I don't know what the frequency is.
Okay.
Frankly, I'm sorry, I can't help you with that.
Yeah, most of these
Like
companies have proprietary frequencies that
Okay.
they use. You know,
So they really don't
the
reveal.
red infrared has
Right, the infrared.
tissue
Yeah.
tissue penetration, and I think just any frequency in the red infrared and
Okay,
will be beneficial for you.
I gotcha. And just like a few seconds? Like,
Well, that depends on the intensity.
Yeah.
Okay.
And also the pulsation. Researchers have found that red light delivered at a frequency, a pulsation, will have a deeper penetrating effect.
Okay. And I guess we don't have to go too deep because the glands are right there at the surface that we're trying to clear.
Right, the superficial. So it's interesting, the lower the frequency gets a deeper penetration. I know when we're treating macular degeneration, we want to do 3 hertz, or about 3 to 5 cycles a second. And then if you get up to 1,000 hertz, that's superficial on the skin. So you want to probably be in the high hundreds in terms of a frequency for the meibomian glands.
And are you hitting that at the side of the head, not through the front of the eye, right? More like at the side to hit the retina or the macula in the back?
Well, for the meibomian glands, you're going to be treating them directly over the closed eyelid.
Yeah, I meant for the macula, because I also have an epiretinal membrane that goes over my macula. So we have 2 problems in this household. One dry eye with the glands in the front, and then the other with the epiretinal membrane across the macula in the back.
Well,
and we have a laser.
You want to use that directly through the closed eyelid, but be cautious. Do not open your eyes because
Gotcha.
laser intensity can be very damaging to the retina.
Okay.
There is a protective device that you can put on the cornea, a protective device that will prevent the energy from going to the macula.
Gotcha.
And by the way, the epiretinal membranes, they're tough. Epiretinal membranes are hard to get rid of, and we fight that every day. We see, I bet, 4 or 5 cases of epiretinal membrane every day, and it's very difficult to get rid of. The only good news there is that almost always it's one eye that's affected,
Right.
and so as long as the macula is doing okay in your other eye, then you won't have a lot of problems functioning and all that.
That's the case. Yeah. It's just one eye. But I use Msm Drops, which don't really melt it. I was hoping there's something that would soften the scar. It's basically scar tissue across the macula. And I was hoping the Msm Drops, I've used those for a while, and they just don't seem to do anything. So I don't know about Dr. Condrart's drops, if that would help.
Well, the MSM drops just don't get penetration to the retina. So there really are no eye drops which will get you penetration to the retina. You have to take something systemically to get into your vascular system to get to the retina. That's where all Dr. Mcnair's comments about, good nutrition, anti-inflammatory, detoxifying the body, all these things are going to be helpful for an epiretinal membrane. You have to look at the cause. And I do think it's a toxic phenomena, inflammation.
Actually, the cause was I had a retinal excuse me here. I had a tear, a horseshoe tear on my retina, where I had a little trauma. And so that got spot welded down. And my understanding is when you have that kind of laser treatment, that down the road will lead to an epiretinal, which is basically just scar tissue that has grown. And unfortunately, it crossed my macula, which gives me double vision and blurry vision, but not terrible, not bad enough to have surgery.
Right. So that's why, all these other things like Dr. Conrad just listed, I would encourage you to read about every different approach. Even this is going to sound far out, but of course this whole talk is a little bit far out. But this, even meditation can help the body. In other words, what I'm saying is totally away from the eye, but we're talking about the whole body being affected and healing of the whole system. So even just a really good, healthy meditation, doing it often, every day if you can, will help the body heal itself is the thing. That's what we're trying to turn on, our healing ability by, how you approach your whole spiritual soul, your body, your biochemistry, the physiology, everything that you can. And by the way, once you've done all that, then you just have to rest and say, hey, I've done everything I can do. And so I got to trust the creator. We're gonna do okay.
Hey, James, that's a good lead in
so-
for the talk next week.
Okay.
I'm talking about homeopathy.
Oh,
That's
good.
and homeopathy treats, the mind, the emotional, the mental, and the physical. And homeopathy, I've seen miracles with homeopathy all the time.
Yeah. Things you just
Thank you.
can't imagine will happen with homeopathy where nothing else seemed to help, although all of it does add together. So, if you're eating horribly and all that, homeopathy isn't going to work as well. But
Right.
if you're doing the whole picture, then you have a great chance of healing that. I have a question here about cataracts diagnosis 2 years ago from Harry Atma Klasa. What should I do for cataracts? Well, first off, don't have surgery until you feel like you need to have surgery. I have seen doctors recommend surgery where I think it's too early. I mean, it's hard to beat our natural lens. It's hard to beat it. So I would be very careful about getting to cataract surgery too early. But when you can't function, you can't read, you can't drive safely, you can't do the things you want to do, then it's appropriate for surgery. In the meantime, I have seen people improved by things like chelation therapy. Chelation therapy will help the whole body from head to toe, and vision improvement is a significant help. Dr. Conrad can attest to that too. Chelation is removing heavy metals out of the body. Heavy metals like lead is we consider to be a cause of cataracts because of the oxidative function. It oxidizes the proteins. So again, that may be one approach, but there's about 80 other ones that are listed in the book that, different things that can help cataracts. So once again, you apply everything that you can apply. Once you have to have surgery, if you have to have surgery, thankfully, it's a wonderful procedure almost always. But if it were me, I'd delay it until I just had to have it, And also Olivia says, how about DMSO? Dr. Conrad, have you had success with DMSO?
Not so much for the treatment of cataracts. I know Dr. Rowan advocated to drop a mixture of DMSO, glutathione, and ascorbic acid. It has been beneficial for some people, but the problem is the formulation. It's rather expensive. I like an eye drop called Occlumed, and it has NAC, ascorbic acid, and that's been the only drop that I have found to be effective in reducing and reversing a cataracts in many cases.
And say the name of it again.
Occlumed, Oclumed. But once again, you have to treat the whole body. If you have a lousy diet, your lead is off the chart, you're stressed, hey, the Occlumed's not going to help. But if you change your diet And I like you emphasized hydration. And my goodness, we could get rid of so many chronic diseases if people would just drink more water. But, you know, it's not glamorous, like taking expensive telomere vitamins and, you know,
Right.
it's not
Right.
very glamorous, but you got to drink a good source of water.
Yeah.
You know, our water table's been contaminated. So I'm a big advocate of reverse osmosis. And now we have a distiller at home. It's a simple unit, and we can distill a gallon of water in a couple of hours. And we use that for all our drinking water.
Yeah. And then it's a
Does
good
that-
idea, if you do that, to be taking minerals by mouth as a supplement too.
Yeah. Mhm.
Very important to do that. I think I missed a question, but here's a question from Susan Levy. Can you take Ocumed and Cosopt, a glaucoma drop? There shouldn't be any contraindication for that. Would the Ocumed, again, I'm not familiar with that, but I can imagine there'd be no problem. You know, when you put a drop in, after 5 minutes, it's basically absorbed completely. So you can put a second drop in, but I would wait at least that 5 minutes in
Yeah,
between.
that's the
two
important
drops.
thing, is just waiting 5 minutes or so before they'll put them in together.
Right.
Maybe an interaction.
How does the Ocumed work on a, would it possibly work on a upper retinal membrane?
No, because once again, you're not getting a penetration to the retina. You're
okay.
better off taking, you know, oral products, a good nutritional vitamin,
Okay.
taking NAC,
Yeah.
maybe taking the liposomal glutathione. But I'm a big advocate of diet. You know, if God wanted us to take vitamins, he'd grow them on trees.
Thank
you.
you.
So how much garlic do you take? I mean, like, do you eat it? Do you eat the amount, or do you take that non-stinky garlic?
Well, I take some garlic capsules. They do have the odorless garlic capsules, which I take. And I love Italian food. So, you know, I
So do
love
I.
a lot of garlic in my spaghetti and garlic bread.
Gotcha. Okay.
You know, but everybody's different. So I can't recommend that you take, you know, 5 cloves of garlic a day. You have to listen to your body.
Okay.
Dr. McNamara, back to water. You were mentioning water. I was going to ask the question, is the Italian mineral water pretty good source?
I'm not familiar with Italian mineral water. Tell me more about that.
Well, it's a carbonated water that comes from mineral springs. And I was just wondering how good of a source of water is that for you? I drink a lot of it.
Let me suggest, go to a health food store and get a pH strip. They have them, the health food stores, they're not terribly expensive. You can get pH strips and you can measure how alkaline the water is. I think, in other words, some of the waters advertise that they're alkaline, and if you take those pH strips, they're not really alkaline.
Okay.
You know, it's surprising enough. So I can't tell you any more about the Italian water, but I would say if it's more alkaline or neutral, at least neutral, then I would say it'd probably be fine for you. And I just don't know much about it.
Okay, thank you.
Also, just because it's from a natural spring doesn't mean it's healthy from you, because it could be contaminated with arsenic and heavy metals. So you have to really be careful.
In fact, Mary says some of those waters have high calcium. Well, can that be a problem? Well, it can be if you can actually get too much calcium in your body. However, it is a very important mineral too. So the high calcium may be a problem, but I'm not familiar with that.
Oh, Dr. McNair, the old time ophthalmologist, that's before our time. I'm talking about in the 20s and 30s. They felt there were the main 3 causes for cataracts: too much salt, too much sugar, and hard water. They were the 3 causes of cataracts. That was the first thing the old timers did when somebody came in. Reduce salt, eliminate sugar, stay away from hard water. So the calcium, high calcium, might be
Could be a
possible
problem.
etiology of the cataracts.
And then Mary says needs to be balanced with magnesium. Good for you. That's exactly right. Magnesium needs to be balanced in the body and very important. Now, most people have enough calcium, not enough magnesium. And so that's one of the better supplements that I think would help.
On the distilling machine that you're using, have you measured the pH that it brings your water to? Is it, and what would you consider satisfactory using those strips?
Yeah, now, Dr. Conrad's been doing the distilling. What do you use? Do you measure the pH at all?
Not really, because the pH should be neutral. Distilled
Should be.
water has a pH of being neutral.
Yeah.
And of course, it'd be nice to drink some, alkaline water. You can always put a couple pinches of baking soda in, but I think that the best way to get your body alkaline is by eating a good, healthy, organic, raw fruits and vegetable diet. It's a more natural way of doing it.
What level of pH do you achieve, or do you use those strips for your patients for like saliva testing or urine testing?
Well, you don't want to see an acidic pH, check your saliva and your urine. So if it's under 7, you're acidic. So actually you want to try to be a pH of 7 or maybe 7.1, 7.2, slightly alkaline.
Both on the saliva and the urine?
Yeah, both on the saliva and urine, but that depends, because remember, your urine is you're excreting toxins. So your urine may be acidic because you're eliminating toxins from your body. So
right. Thank you.
You bet. That's a good question. And I haven't done a lot of that, and I'll tell you why. Because if I ask an eye patient for a sample of their urine, guess what they're going to think? That guy's nuts.
The medical board's going to come after you.
Exactly. That's what I'm saying. That's what I'm saying. I just, so I try, frankly, not to be too offensive with people and yet at the same time to get as much information to them as I can without, again, saying, oh, what's he's kooky. He's too crazy for me. But so anyway, it's a fine balance there. But if I was practicing strictly integrative medicine, and that's what people were coming to me for, I would definitely be doing that. And another thing I'd be doing for women, particularly bioidentical hormones. Bioidentical hormones can be a big help for ladies particularly, and as far as we're talking about dry eye problems, I'm telling you that can be a real big issue. But I haven't really talked to a lot of people about that because of that very thing. Again, it's just, I want to kind of stay under the grid or off the grid or whatever. But on the other hand, I like to see people get well. So we do as much as we can. Now, here's a question that says, if you have to have cataract surgery, do you have any info about the type of artificial lenses that can adjust focus? And there are some new lenses out that have been extremely successful. I have used several of them over the last year, and we don't do a lot of that because I tell people if they're a good candidate for it, I'll tell them that, but they're a little bit pricey. And we're talking about is what a lens can do, not only see distance real well, but also up close, basically bifocal lenses. And they are wonderful if they work. I have seen almost everybody has been successful. If you have to drive a lot at night, you may want to be aware that you can have halos around lights from the lens implant. But if you don't have to do that, many people can do extremely well with those. So now the product I work with is Alcon, A-L-C-O-N. Alcon is a wonderful company. Allergan's another one that has great products, and B&L has great products. So there's a number of good lenses out there. Any ophthalmologist who is worth their salt, they're not going to lead you into a bad lens implant. They're not going to put something that could hurt you or anything like that. So you know, if you have a doctor that you have a lot of confidence in, I would say, you know, and they've had good experience and all that kind of thing, I wouldn't worry too much about it. And I think I would try that if you have the funds to out of pocket money is what I'm saying. So yeah, it can be a very nice thing to have though.
Also, I think it's the experience of the ophthalmologist that, you know, you may work with one particular lens and you get good results. It's not very helpful for when a patient comes in and tells the eye doctor, I want you to use this lens. You know, he may not have any experience with that lens and his results aren't going to be that good. We tend to use lenses, right, Dr. Mcnair, that we get good results with and we're comfortable with. So, and of course, you always have the hype of the marketing of the companies, their products the best. But the bottom line is, you know, the results that you see in your patients, and sometimes they're totally different than the results that you see on TV or that are marketed.
I just wonder, no,
Can I ask a second question?
I bet you can.
Dr. Mcnair, you were just talking about halos.
Yeah.
What is something that can be done for halos before you have cataract surgery
Well,
or the
yeah,
glare?
good question. So if you have early cataracts, the cataracts are the most common cause of the halos, but tear film can cause it too. The tear film can, and then of course, and I was just saying the artificial lenses can, but cataract being by far and away the most common thing to cause halos. There's not a lot, Charlene, that can be done that I'm aware of. I would say do everything you can for the tear film, everything you can for the macula and all that kind of thing. Some of the tricks I've tried, there's a new dropout, in fact, but I have used in the past pilocarpine in very low doses. What that does is constrict the pupil, so it gives you kind of a pinhole effect.
Oh.
But which is kind of interesting, you know, but on the other hand, now let me say, if you have cataracts, it can make your vision worse, actually. So it's worth a try, but it's also not a guarantee that it would help. But there's not a lot more that you can do other than, you know, like say tear film, macula, all that kind of thing. How about you, Dr. Conrad?
Well, you know, they're saying now that low dose pilocarpine can help improve your reading vision.
Yes, yes.
And, you know, when Dr. Mcnair and I first went into practice, pilocarpine was the only drop we had to treat glaucoma.
Yeah, that's right. That's right.
And now, you know, it seems like there's a resurgence in the interest in pilocarpine.
Exactly. Yeah.
So,
And do you have to have these ordered from your eye doctor, or can you just purchase them?
No, this is a prescription medication, and
Okay.
you know, it can cause some harmful side effects too. So you don't want to just indiscriminately use it. I would talk to your eye doctor about that.
Okay. Thank you.
Yep. Dr. Conrad, I have missed some of the questions, and I just wonder.
Well, we're kind of running out of time. I don't know if anybody has a pressing question. Maybe they could raise their hand or just unmute yourself and fire away at Dr. Mcnair, because I think you've answered a lot of the questions that were asked.
Dr. Conrad, I've got a question. This is Betty.
Hi, Betty. How are you?
Good, good. I'm recovering from you know, COVID, the Omicron virus, and you know, taking salt water, gargling, you know, salt water through the nose. And when I had an eye doctor appointment this past week, and the swelling of the retina had reduced significantly, which I contribute to the microcurrent therapy, but my glaucoma, my eye pressure was up a bit. And I just didn't know if doing those saltwater treatment could have stimulated my eye pressure. I don't know.
Well, that's a good question. Actually, salt water is osmotic, and it should actually lower your pressure. not
Thanks.
raise it.
Hmm.
It could be the way that the eye doctor measured your pressure, because a lot of doctors use what they call the air puff. It's a puff of air,
No, it
and that
wasn't.
tends
It
to be
wasn't.
high.
Right. It wasn't that one. It's the blue light.
Yeah, that's a very accurate way of doing it. So you may want to, just could be an unusual reading. I'm happy to hear that your retinal swelling is better.
Right, but I wasn't seeing as well. I'm not seeing as well out of the right eye. So I just didn't know if that salt water could have, done that or not.
I wouldn't think so, but I would also say, if you're on the heels of the COVID virus problem, I would not worry too much about it right now, and get fully recovered from that. And the IV therapy, I was telling you earlier about IV therapy. If you can find someone that does Myers cocktails, MYERS cocktails, I have seen that help people recover from the COVID more completely.
Okay.
And it's like a high dose of vitamin C and B vitamins and glutathione. We were talking about glutathione earlier being a helpful detoxifying. And it's not terribly expensive, but one of your integrative doctors in wherever you live there, I bet you'll be able to find someone that does Myers cocktail.
Okay, thank you so much.
You bet.
Okay, well, I think that we're coming to a close. I want to thank you, Dr. McNair. Fantastic presentation. I think
Well,
everyone
thank you.
really appreciates you and the work that you're doing. And I appreciate you as a friend. You and I are in this together, taking the slings and arrows from a lot of fellow ophthalmologists, right?
Well, no kidding, no kidding. It's always been, I enjoy working with you tremendously, and you've got a great sense of humor. And by the way, a real giving heart too, a missionary heart. And it's wonderful to work with somebody like that. So thank you, Dr. Condron.
So this is being recorded, so we'll be posting the recording. And next weekend, we have a very important speaker, myself. I'm going to be talking about homeopathy. So I hope to see everyone next weekend. So thanks so much, Dr. McNair, and thanks all of you for joining us for the Vision event. Take care, everyone.
Yes, sir.
Thank you so much.
Thank you.
Wonderful presentation.
Thank you.
Wonderful presentation.
Appreciate you.
Bye.
Bye.
Thank you.
Bye-bye.
Bye.